Sexual Humanitarianism, Migration, Sex Work and Trafficking studies the relation between migration, sex work, and trafficking in the global sex industry by analysing migrants' own understanding and experiences of agency and exploitation. My name is Annah Pickering, and my co-chair is Miss Jenny Lee. When I think about migration, I think about my own family, like so many families that migrated to Aotearoa, New Zealand. In many respects, we still feel like we are still migrating. Our daily work at NZPC, Aotearoa, New Zealand, Sex Worker Collective work with migrant sex workers, we're struck by many things that impact migrant sex workers' lives and their experiences. It is a privilege and honour to share those stories and be part of SEXHUM Aotearoa New Zealand project. I'm going to hand over to my colleague and co-chair, Miss Jenny Lee. We were both involved in the field research.
Good morning and good evening.
Good morning.
We will present the SEXHUM's resource and the policy making suggestions in New Zealand, where the project focuses on the impact of the Section 19 of otherwise decriminalising Prostitution Reform Act 2003, which made it not legal for migrants on temporary visa to work in the sex industry. We sent the advisory committee, Professor Gillian Abel, Dr. Lance Armstrong, Dr. Michael Rogitsky, Team Kevin Healy. We sent our research funding partners, Kingston University London, European Resource Council.
Our first presenter this morning and evening is Professor Nick Mai, a sociologist, an ethnographer and a filmmaker working as a professor in sociology and migration studies at Kingston University London. His academic writing and films focus on the experiences and representations of migrant sex workers in the global sex industry. Through experimental documentaries and original research findings, Professor Nick Mai challenges prevailing humanitarian representations of the relationship between migration and sex work in terms of trafficking, while analysing sex workers' complex experiences and understandings of exploitation and agency. Thank you, Professor.
Thank you very much, Jenny and Anna, for this introduction. And thank you, everybody, for being here today. I am very excited about finally having the chance to present findings of the SEXHUM project in New Zealand after 4 years of work. So today I will speak at the beginning to give a bit of an overview about the project and what it set itself out to do and what we have achieved and its wider framework. And then I'll let it up to Calum Bennachie, who was the lead researcher on the project, to talk about what we found out and what we did in New Zealand. So I will now share my PowerPoint as is to just guide you through what we did. So 1 second. Right. Okay. So okay. So the project SEXHUM Migration, Sex Work and Trafficking studies the relationship between migration, of course, sex work and trafficking in strategic sex work and migration sites in the global north. So we chose to work in Australia, France, New Zealand, and the US because they are representative of very different migration systems, but also of different policymaking approaches towards sex work. We focus on migrant sex workers' understanding of agency and exploitation through a coherent, innovative, and collaborative methodology. The idea behind the project is that everybody else talks about agency and exploitation, but sex workers themselves. So what we wanted to do was to try and gather what people who are directly concerned think about exploitation, what it means, how is it different from sex work, and how is it different from trafficking, starting from their own experiences. The main concept at the core of the project is sexual humanitarianism, which means, which refers to the increasing way in which some migrant groups or individuals tends to be targeted or understood by humanitarian concerns, by policies, interventions, and also representations as specifically and uniquely vulnerable in relation to their sexual behavior. The problem with this being that this often legitimizes harmful anti-sex work and anti-immigration initiatives. So a parallel of sexual humanitarianism could be military humanitarianism, which means the way in which, you know, humanitarian concerns have been mobilized to legitimate you know, wars and military interventions. So the project adopts an innovative art science approach. We have, it has hired a postdoctoral researcher for 36 months to conduct long-term ethnographic observation and then qualitative interviewing, so 50 interviews with migrant sex workers in each of the 4 national sites, and between 10 and 20 interviews with key informants in each national site, and collaborative ethnographic filmmaking, which is something that I have been in charge of more directly, and consists in working with groups of migrants in the context of the collaboratively in order to write together and produce together fictional films and stories that you know, talk about their lives and allow them to talk about their lives in different ways. The research team was composed of the following people. In Australia, we have PG Maciotti. In France, Calogero Giametta. In New Zealand, our very own Calum Bennachie. And in the US, 3 people, because in the US we looked at New York and LA. So Annie Ferenbacher, Jennifer Musto, and Heidi Homefinger. They really were responsible for research on the ground. And I coordinated things and tried to also do some field work specifically in each country. Okay, so the results achieved were that we undertook all of the interviews. So we were supposed to make 50 in each country. We did 216. And we also achieved the target of key informants. So we're very proud of this because we struggled in some countries, particularly in New Zealand, as Calum will tell you later, because of different reasons and because of structurally the stigma and the criminalization of the population that we're talking about. So we also did extra 10, more or less, in each country, COVID-19 interviews, because we felt that it was impossible for the project not to talk about this specific aspect, which has changed our lives so much just in the few months since it's happened. And on the ethnofiction sides, we wrote 4 ethnofiction films in terms of script, so 1 in each country, but we decided to shoot the one in New York and the one in Paris, because that's where we had the full support of local sex worker rights organizations as protagonists and collaborators in the project. So it became a shared collaborative project. Publications, we now have 2 peer-reviewed articles published, a special issue of Social Sciences in preparation, 1 book chapter, 1 blog article, and many more publications planned. We are very proud to also have co-written with Doctors of the World the report on the negative impact of the 2016 law against the so-called prostitutional system on the rights and lives of sex workers in France. Calogero Giametta was one of the 2 co-authors of this report, which was a very strong contribution, made a strong contribution to the public debates on the effect of that law in France. So we try to achieve as diverse a sample as possible, trying to reach out to the broadest range of a variety of people in terms of ethnicity, area of work, migration, sex, gender identity, class, and race. But we purposely included racialized and sex gendered minorities because as research participants and also as peer researchers, because they are particularly targeted by sexual humanitarian intervention and wider, as we know, dynamics of social exclusion, marginalization, and criminalization, just in the spirit of the project that tries to include people who are directly concerned at the forefront of their own representation, also scientifically. I'm gonna now give you a very quick, necessarily, overview of what we did and what we focused on in each country, and then draw some conclusion about the main findings of the project before leaving the floor to Calum. So in France, obviously, the project focused on the adoption of the so-called Swedish or Northern model, which aims to fight against the prostitutional system. This is a definition that of sex work that is embedded in the law. It was introduced in April 2016. As we all know, the so-called Nordic model criminalizes clients and decriminalizes soliciting and sex workers. But this has coincided in France with an increase in municipal restriction orders. So that was an important limitation that was found. And also the law instituted exiting programs that excluded the migrants that were most vulnerable to trafficking from them, because of the fear of instituting and creating a parallel immigration channel. So that was a bit of the context of the law and the limitations that were put to it. The Chronicle of a Disastrous Foretold refers to the fact that I did a project in 2014 and 2015 before the law was passed, which had already anticipated some of the very negative impacts of the law, because people started behaving as if the law had been passed before it did. But then these negative, already forecast were confirmed, unfortunately, because the law led to a further precariousness of sex workers who need to spend more money and do more clients and more dangerous clients, more time and accept more dangerous clients for less money. There's been an increase in violence and abuse from criminals and clients alike. And in some cases, people had to interrupt their HIV and AIDS treatment because they had to move to different cities to work because of the scarcity of work that the law created. In the United States, of course, it's a very different environment, because whereas in France, it was only, the Swedish model was introduced. In the United States, it's a completely criminalized environment, except from some rural countries in Nevada. We focused in New York and LA. In New York, we focused on the human trafficking intervention courts, which are diversion courts that clear people's criminal records through mandatory sessions that people have to, of course, attend, ranging from yoga classes to language trainings to actually health services that sometimes are useful to people as well. And in LA, we looked at the fact that California and LA are very close to the Mexican border, and so the interest there was to see whether there was a prevalence of trafficking because of that proximity to the border. In New York, what we found there was a high number of domestic adult cases, but this is in a context where trafficking is equated with sex work, and where there is a de facto criminalization of racialized poverty. So when you look at the populations that gets to be caught up in these courts, the majority are African American cis women, Asian cis women, and Latinx trans women that get to be caught up, because they are more visible in racialized terms, and they get to be picked up by the police more. The limitation of the courts is that they operate according to the logic of penal welfare and the ethos of arresting in order to assist, which are disruptive of sex workers' life, and they do not address the prevention of their structural socioeconomic marginalization. So yes, in a way, they do prevent people from you know, having a criminal record, but they are part of the system when it comes down to, you know, their embeddedness in a criminalized, you know, framework, which they don't have the power to, you know, to shift. And also under the Trump, the project demonstrated the impact of the Trump administration on the lives and rights of sex workers, which has been disastrous. You know, people began being arrested by the ICE, which is the equivalent of Immigration New Zealand, at the courts themselves, which means that, you know, people who were defending their cases of trafficking were prevented from defending their, you know, their rights for fear of being arrested and therefore deported. The project also documented the impact of the SESTA FOSTA law. We have spoken to sex workers, particularly racialized, marginalized sex workers who were forced to go to the street and therefore face an increased risk of violence and arrest. And we all know what it means to be racialized and arrested in America increasingly after everything that's happened this year. So overall, we witnessed an increased surveillance, arrest, and incarceration of African-American sex workers and deportation of racialized migrants. That's what we saw in New York. In LA, the situation is worse because there isn't a parallel network and framework of humanitarian assistance. There are some initiatives, of course, but not to the same extent that there are in New York. So there is a hypercriminalization of undocumented migrants and US citizens who are racialized as non-citizens. So we witness an intensified form of surveillance and immigration enforcement, whereas for transgender sex workers, they are, including migrants, experience exploitation and often trafficking as well. They tend to be treated as criminal offenders without any protective, you know, humanitarian or anti-trafficking laws. So the situation is worse in LA. In Australia, which is the last case I am going to present, because I'm definitely not going to talk about New Zealand because we have the expert speaking in a few minutes. So it was the best practice we found, because we compared a partially decriminalized but quite, you know, quite well decriminalized environment in New South Wales, in Sydney, with a more regulated environment in Victoria. We found very low numbers of migrants without visa. This is confirming existing studies as well carried out by sex worker-led research by SWAP New South Wales and Scarlet Alliance, and very low numbers of victims of trafficking in the sex industry. So we confirm and build on those data. And throughout the project, life of the project, there's been a growing awareness of slavery in sectors other than sex work, which of course poses its own problems because, you know, the enforcement of anti-slavery measures can become also a legitimation of anti-migration, you know, attitudes in other fields than sex work. Together with the positive chances, of course. But Australia is, of course, not safe from cyclic anti-decriminalization and abolitionist critiques and moral panics. During the project, the life of the project, we witnessed one of them emerging about the supposed exploitation of Asian sex workers in non-authorized massage parlors. I'm doing scary quotes next to Asian because Asian means different things in different countries, different population in different countries. And so this is a population that we focused on. We focused on non-authorized massage parlors to see whether there was a truth to these moral panics, and we found that there wasn't. And I will get more in detail with the next slide. There are also raids of immigration police and councils in New South Wales, the latter ongoing in both Victoria and New South Wales. And there are non-licensed or unauthorized venues are targeted by the police with the help also of neo-abolitionist organizations, and also owners of licensed venues that fear competition and use the trafficking kind of metaphor or excuse to crack down on competition. We found evidence of exploitation. And sex workers described exploitation as non-supportive managers, receptionists, or owners, as blackmailing by managers and owners, long working hours, being pushed to have unprotected sex by clients, non-compliance with labor occupational health standards, and poor hygiene. This is what people came up with when we asked, what does exploitation look like? How do you experience exploitation? At the same time, in New South Wales, sex workers found it easier to leave exploitative shops than in Victoria. So in a more decriminalized environment and more fluid environment, people found it easier to escape basically exploitation and find better jobs in the sex industry if they so wanted. And we didn't find worse working conditions in non-authorized or unlicensed brothels than in legal or in approved ones. On the contrary, some of the women involved thought that it was less stigmatizing to work for a massage parlor that at least in name offered massage, and clients also felt reassured sometimes that that by purchasing sexual services in a place like that where sex was not on the menu, women they thought women were more likely to consent. So it was actually the opposite what we found than moral panic. Okay, so I'm now wrapping up. In terms of main findings, the majority, sex work, the majority of people we talked to and their understanding show that sex work does not coincide with sexual exploitation and trafficking, and it is actually an important livelihood and source of work for migrants. Most of our research participants saw sex work as work. That doesn't mean that they are militant, but that's the way they described it. They understood and experienced exploitation in terms of labor, as I said before, while talking about Australia, rather than sexual exploitation. And unfortunately, humanitarian concerns and intervention on sex work across all the 4 countries tend to legitimize increasingly repressive, racialized, and extreme forms of migration control. So if there's a direction that SEXHUM humanitarianism is following, is towards more extreme forms of racialized borderings in all the countries that we worked in. Humanitarian concerns tend to focus on racialized migrant populations such as Asian cis women, but other groups that are racialized tend to be neglected. For example, trans Latino women, they tend to be neglected from the main concerns and therefore from opportunities for support. There is actually a proportional relationship between the degree of racialization of migrant groups and their subjection to sexual humanitarian concerns, controls, or bordering. So we found that racialization was a prism through which sexual humanitarianism could be explained more and its functioning as well. This is something we focused in our publications. And the last finding, more theoretically, is that migrant agency and exploitation are embedded in collective experiences. This is something that came up very strong from the ethnofiction work, both with Latina women in New York and with Chinese women in Paris. So this means that we need to stop addressing these vulnerabilities and these understandings and experiences in terms of individual realities, but actually try to support the communities that sustain and through which people live, because this is the main dimension through which people understand themselves and their agency and their exploitation. Okay, final slide. In terms of policy making, there is an inversely proportional relationship between the degree of criminalization of sex work and the ability of migrant and non-migrant sex worker to assert their rights and live their lives. So the more criminalization there is, the less people are able to assert themselves and protect themselves. This is something that was very clear comparing, the US, France, Australia, and New Zealand. It came through a unified, methodology. That was something that came through very, very, very clearly. And therefore, decriminalization of all forms of sex work is a fundamental starting point to counter the social and economic vulnerabilities and the violence, abuse, and exploitation that are associated with sex work. But they are also not enough. So we found Peter Ostergren's definition of integrative policies versus repressive policies very useful. And so the last findings that I wanted to evidence was that decriminalization of sex work should be always associated with broader integrative policies supporting people who are excluded from work, housing, and society according to their race, ethnicity, gender, sexuality, class, and migration status for it to work. Otherwise, it becomes just a project that reaches out to the few and not to the many. Okay, so this is it for me. Thank you very much for coming today. There is a lot more information on the project on its website, and I'll now stop talking and leave the platform for Calum, who's going to talk to you about New Zealand.
Our second presenter is Dr. Calum Bennachie. He against his PhD in the Gender Studies through Victoria University of Wellington in 2010. He previously worked for the New Zealand Prostitution Collective from 1999 to 2017, covering police, administration, and sexual health education. And was involved in the passage of the Prostitution Reform Act between 2000 and 2003. His publication reflects his interest in a background in policy and legislation, and how this can be used to protect the rights, health, and well-being of sex workers.
Thank you, Jenny Lee, for that introduction. I'll just call up the presentation now. Right. New Zealand passed the Prostitution Reform Act way back in 2003, so it's been in place now for 17 years. Now, that act decriminalised sex work for all citizens and permanent residents, creating a framework that safeguards human rights of sex workers, protects them from exploitation, promotes the welfare and occupational health and safety of sex workers, is conducive to public health, and prohibits the use and prostitution of persons under 18. So you can see there that it's got a very strong rights-based origin to it there. However, during the final stages, as it was going through Parliament, the then Minister of Immigration added what became Section 19, which meant that any person entering New Zealand with the intention of working as a sex worker may be denied entry, and that any person on a temporary visa, that's work visa, visitor's visa, student visa, etc., all those ones, who starts sex work in New Zealand may be deported if they're found to be working. Furthermore, any person on a temporary visa or with permanent residency could not operate a brothel. A permanent resident could work as a sex worker, but could not operate a brothel. Some of the brothel operators I did interview were on permanent residency and were quite shocked and horrified to find out that they too could be deported. But very few of those people actually decided that they would be interviewed, and when push came to shove about being interviewed, they said no, they didn't want to be. I interviewed 50 migrant sex workers here in New Zealand. Jenny Lee was the translator for some of them. Some of them, one of them supplied their own translator, and a couple were translated by someone else. Interviewees were provided with an incentive of $50, which doesn't sound much, but it's a help at any time. And most of the people who took part found it interesting and exciting to be able to be interviewed and have their responses recorded in this way. Now, we weren't allowed to take a digital recording of the sex workers themselves, so what we did, I typed the replies up as they were speaking, and then I read them back or let them read them, and they agreed to what was being said. If they didn't agree, I changed it to what they wanted. There were 15 key informants that were interviewed, and this comprised of NZPC staff, staff from MBIE, both WorkSafe and immigration, journalists, moteliers, faith-based organisations, etc. Interviewees were obtained by contacting the organisations themselves, and their responses were digitally recorded. And at the end of it all, responses were coded, and that allowed us to see patterns that existed. So where did all these migrant sex workers come from? This was the country of origin for most of them. As you can see, it's spread right across the world. The ones that you can't see are all the Pacifica ones that took part as well, over here and over here above New Zealand. So places like Fiji, Samoa, they had people that were interviewed, but they're not really showing up. There's one there. But the gender was predominantly female, as you can see, with some male, some transgender, and some gender non-conforming people. So it was quite interesting to have the breakdown like that. But places they were interviewed, there were 35 interviews completed in Auckland, some in Wellington and one in Christchurch. Most of the interviews were done on NZPC premises. And this was because people were quite happy and content to be interviewed at NZPC premises rather than in a brothel or elsewhere. Quite often it was them that suggested the being interviewed there, but also because they'd been encouraged to take part in the interviews by NZPC staff. Nevertheless, there were some people who weren't encouraged by NZPC staff, but were obtained through other means, and they still wanted to be interviewed at NZPC. But some of them were interviewed at home, some of them interviewed in their own small owner-operated brothels. Some of them were interviewed in the brothel that they worked in, and some of them were interviewed in other places, such as on the beach, in a car. The one that was interviewed in a car, it was raining really heavily at the time. They had wanted to be outside, but being in the car was the next best thing. We couldn't do the interview where they were working because there was someone else working in that same place and they already had a client. So I couldn't do that. Ages, they ranged in age from 18 through to 54, with the average age being 36. Now, 2 young people who had been working under the age of 18 were interviewed to obtain responses from people who were actually legally classed as victims of trafficking, but they were interviewed only after they had turned 18. This was interesting to see the difference between the visa at the time of interview and the visa at the time of sex work, because sometimes there was a crossover at the time of interview and at the time they were doing sex work, and sometimes it was a few months or so since they'd been doing sex work before they, and then there may have been a change of visa in between times. So you can see that there was one person who was on a visitor's visa and that it expired, and that's on both sides there. Some were on a working holiday. Visitor's visa was by far the most common, and then student visa. Issues affecting health were among the most prominent. A lot of migrant sex workers said that they were afraid to contact doctors or to attend clinics or to actually go and see a doctor about anything, not just something related to sex work. They may have turned up to NZPC clinics where those were available. But they wouldn't go to a GP, or they wouldn't go to another sexual health clinic just in case they were asked about where they were working, because there was always that fear that they could be turned over to immigration and deported. Similarly, with issues affecting their safety, migrant sex workers wouldn't approach police even though the matter didn't relate to their sex work. One of them told me that they would, even if they were assaulted outside a nightclub or on the street or had their car stolen, they would not report it to the police because of that fear of being deported. None reported trafficking within the sex industry, but they had heard of it happening overseas. They were fairly certain that because of the laws that we have here in New Zealand, it would have been difficult to have someone who was trafficked, simply because other people would tell. However, some of the people had been served deportation liability notices, and they felt a degree of trafficking-like conditions because they felt that they were being forced to see clients they didn't want to see, being forced to work for longer hours than they thought they would have to do, simply because they had to get the money together within that 28 days to leave the country. Nevertheless, all of those who were employed in the hospitality industry before working in the sex industry felt that they had been exploited within the hospitality industry. And that's not just those in restaurants, but also bars, and even in mainline hotels doing cleaning and other places like that. So there was quite a concern about that. There was issues of bodily sovereignty that were raised as well during questioning by authorities. So looking at health first, and Leah was the one where it was the most concerning, because their temperature got very high. They were at the point where they could have gone into coma and died as a result of having too high a body temperature. So initially they went to a nurse at NZPC and was assured that it wasn't an STI, but they were concerned about their temperature. So they were sent to the after-hours clinic for a prescription, but they were also concerned about their temperature and sent them to the emergency department. They wanted her to stay so that they could make sure that her temperature was down. But she was so concerned about things that even in her, she called it a delirious state, she ripped up the information about this interview and put it in someone else's, put it in a bin in someone else's cubicle. And that was to avoid any interaction that may have led to her being deported, even though at the time of going to the ED and everything, it was only 5 days away from her leaving the country. And I interviewed her 3 days before she left the country. But she wasn't the only one. Another of the interviewees said that they would be going back to China soon, so they didn't need to do any medical stuff. They would do it all back in China. Someone who worked in the same brothel said that if they did have any health problems, they would go back to their home country. So they felt they didn't need to or want to have any interaction with medical staff here because of the fear that they may have been deported. And Sasha, who was from Eastern Europe, said, "I'm worried about seeing doctors, worried about being found out. I've only been to NZPC and Wellington Sexual Health for checkups. I have tourist insurance, travel insurance, so I can go to other clinics, but I would never reveal any sex industry involvement in case I was deported." She had similar feelings about any contact with the police again. Any crime had been committed against her, she wouldn't have reported it to the police. And that's quite concerning, because it does leave people vulnerable to violence and to exploitative practices and other things that may affect the well-being and safety. one of them said, no, I'm thankful I haven't had any experience with the police. I would not want them knowing what I do. I do not want them to be able to let immigration know what I do. I want to finish my 3 months and be able to come back if I want to. I do not think contact with the police, though, if something went wrong, even if it wasn't at work, because I do not want them knowing what I do, as I think they may tell immigration. And I do not want them to know as I may get deported. So this fear of deportation is very strong among migrant sex workers. And Molly was a woman from the UK, and she'd had a couple of incidents, but the first one was in Hamilton, where there are bylaws that state that a person may not work as a sex worker in motels as well. And there's quite substantial fines for the motelier as well as the sex worker themselves. But she said that this person contacted her. He'd seen her advert and he said that he had friends working in immigration and would tell them what I did and give them my images and advert if I didn't do what he told me. I was too shocked, freaked right out at the time to think properly. So I just did it. And afterwards I was too scared to go to the police to report it, just in case I did get deported or even charged under that bylaw. So there was So there was that issue of a sex worker being forced to have sex with someone they didn't want to have sex with, simply because of the law. Now, that is sexual violation because it is without true consent. Nevertheless, most of the people who took part said that they knew what they were getting into. This person, also from East Europe, said that I did my research, I spoke with people before starting, I wasn't forced except for the fact that I needed money. But we all need money, so we could all say that we're forced to work. But I wasn't forced to do this job. I wasn't coerced, I wasn't forced, I wasn't detained or sent somewhere by anyone. I wasn't misled or told lies about what this job is about. I chose this job. Nobody made me do this. This was pretty typical of most of the replies in response to, do you feel that you've been trafficked? Most of the people who said, who were working as migrant sex workers, knew what they were getting into before they started sex work. They knew what was involved, and they were quite happy to do this job so that they could get money to survive, they could get money to enjoy themselves while they were in the country. However, they did feel that they were exploited in hospitality. It happens a lot in hospital, not paying people properly, shifts 10 to 12 hours or more, yet not paying properly, only paying for 8 hours, not the hours worked. Often people don't know what the rules are and the laws are around work. So they're underpaying, and often the students or young person won't complain because they don't know about the rules. Callbacks with only 4 hours in between, employers asking if someone can come in to do a shift and then asked what time they would finish. And the worker is told, I guess you don't need the money after all, with the employer expecting them to be available at all times, all the time. Another person had been working as a cleaner and they felt that they were being overworked. They were having to do longer hours than they were told in the contract, and yet they were getting only paid minimum wage for doing so, and only paid for the time in their contract, not the extra time that they had to do to actually complete the job. COVID was a very big thing at the end of the interviews, and PG interviewed several sex workers here in New Zealand before the second lockdown in Auckland. This was just after the first lockdown had finished, and Tiago here, non-binary male from South America, said that he felt discriminated by his landlord when he told him that the situation was going to be in COVID-19. Pretty open with them, self-employed. The landlord may have guessed he was a sex worker. Finances were going to be stretched, and he asked if he'd be able to get a discount, postpone payments, or a mixture of options. And a lot of New Zealanders were actually able to do this. A lot of them were able to have a bit of a rent holiday. A lot of them were able to have other financial support made available to them, but not migrant sex workers. The fact that sex working is illegal for me makes some people judge my choices, and they decide not to help me because I'm illegal in the first place. I think it does affect people's choices to help me or not, clients or landlord. The clients told me that they would not help me because I don't pay taxes. They do stigmatize people, and I'm stigmatized by the law in a way that I had never been before. I felt I had an obligation to support society, but there was no return and no obligation from the government to help me help them. Daisy, on the other hand, from East Asia, said that compared to other jobs, migrant sex workers can't get the wage subsidies. It's unfair, totally unfair. Why only migrant sex workers can't get it? Is it because they have to provide to show the details of their job? And if they can show, they can get the subsidies? Migrants also work as sex workers. Now, I wish the situation was improved. If they are a New Zealand citizen, they get support, but not if a migrant. This is unfair. Now, this person had been working in the hospitality industry before lockdown, and then during lockdown was having some financial difficulties. And at the end of lockdown, they decided that they would go and start work in a brothel. So I worked in hospitality, and obviously it was the most affected industry, especially when the border closed. I can't get back home because borders were closed. I was a full-time worker, so the government gave the business 80% to be given to their workers. So I was given that from home. I got that until the end of June. The 100% of wages is already not enough to live on. New Zealand is so expensive. Imagine with 80%. Then talking about after lockdown was completed, I went to the brothel one night, and one night I got my 1 month, and in one night I got my 1 month salary. I had used Tinder and Bumble. So what's the difference? So she's talking there about dating apps, hookup apps, and use on that, and getting and obtaining sex through those, and saying, what's the difference? The main difference is, of course, that the people that she was seeing actually paid her. Now, what could be done to try and make things better for migrant sex workers? A lot of people think that the repeal of Section 19 by itself would be of great assistance, and yes, it would, but people on visitors' visas would still be working in breach of their visa, and therefore be liable for deportation. And students and some other temporary visa holders are currently unable to do contract work because it would put them in breach of their visa. So what we may also have to look at is looking at removing the ban on students, etc., being able to do contract work, and removing the requirement to tie work visas to a particular employer, providing the ability to have a work visa for sex work that people can apply for if they start sex work, but it shouldn't be specified as a sex work visa, and it should not be specific to sex work. Encourage visitor visa holders who are found to be working as sex workers to apply for that work visa rather than immediately deportation. Repeal of Section 19 plus those other changes would fit with the recommendations from the CEDAW Committee in 2018 and reduce the vulnerability of migrant sex workers. So what we're saying is that immigration control should be separated from the enforcement of the Prostitution Reform Act to address the needs of migrant sex workers, to make them less vulnerable, and to protect them. What else could be looked at? An interdepartmental committee consisting of representatives from MB, that's Immigration and Worksafe, Ministry of Women's Affairs, Police, Ministry of Health, and to work with community partners such as NZPC, Shakti, the Anglican Church, etc., to examine the issues and to ensure the rights of migrant sex workers are protected compelled to uphold the recommendations of the CEDAW Committee in 2018, recommending amending Section 19 of the Prostitution Reform Act with a view to reducing its negative impact on migrant women, and adopt measures at preventing discrimination against women in prostitution in the state party with a view to preventing and addressing the factors and structures that render migrant women vulnerable to trafficking. That's a very important recommendation. We would also need to examine the need to have only one employer on a work visa. Currently, a number of work visas are tied to a particular employer, and that means that that person, as we've seen through many cases that have come up recently in hospitality, in restaurants, in petrol stations, etc., and in other places of work where the employee is tied to that one employer for the work visa, and they have been seriously exploited as a result of that. So we need to examine that and find out what could be done to prevent that from happening. Examine the contracting nature of sex work and the impediment it makes from immigrants working as sex workers. And the issues there, if contract work is treated the same as other work, then students and those who are on temporary visas who currently cannot do contract work would be able to do so. Those facing deportation for a breach of the temporary visa should not have sex work recorded on the deportation liability notice or any other paperwork related to the deportation in order to reduce the stigma of being outed as a sex worker and the damage and everything that that stigma causes. Examine the ability to allow sex workers to apply for a work visa and to encourage those on visitors' visas who are found to be working as a sex worker to apply for a work visa rather than an immediate deportation notice. And that visa would not or should not have sex work written into it specifically only for sex work. Thank you, everyone. I'll hand you back now to Anna and Jenny Lee.
Hi there, my colleague and co-chair, Miss Jenny Lee, and I will be presenting on our experiences as field researchers on the SEXHUM project.
Okay, you turn. No.
Okay. Thank you.
When I know the research first, I think it is good for the sex industry and the migrant workers to do this accompanying research. At least someone will listen to their voice. At the first, things did not go very well in the beginning because of the stigmatization of the sex industry. It is difficult for sex workers to trust others. In my experience, in my role at work, I'm building trust and friendship with some workers and brothel owners. The trust and friendship connection played a good role in this study. Through contact and careful explanation, I let the sex worker know that the proposal of this study is to stir for and improve the working environment of migrant workers. In the interviewing space, we try to maintain a relaxed and happy atmosphere here. Let sex workers relax and release the doubt. In this way, we complete the interviews step by step. Thank you.
Thank you. Next. So our experiences as SEXHUM field researchers was that we support the SEXHUM research project, and part of that our involvement was to gather the voices of migrant sex workers' experiences who we were in contact with through outreach and at the community centres, and part of that also was around building trust. And in many of our conversations with migrant sex workers was around the knowledge on Section 19 and the impacts that has for workers who are on temporary visas. Next. And at NZPC, when we are connecting with migrant sex workers, we have our translated resources pertaining to the Prostitution Reform Act, and Section 19 is what is in this picture here. Next. Where are the migrant workers?
Most of the migrant workers, we know them because in NZP's Auckland, we got the research project. Most I know them during the outreach project.
And some of the other connections was through talking to migrant sex workers over the counter. Someone would come in and ask about the clinic, or wanting to pick up supplies, and generally our conversation is, what country do you come from? What type of visa are you holding? Are you aware about Section 19 of the Prostitution Reform Act? And are you interested in taking part in the SEXHUM project? Most of our connections with migrant sex workers at the NZPC community centres and outreach was very positive, and migrant sex workers had a lot to say about the impact of the law. Next. So going forward, being part of the SEXHUM project was the opportunity to raise the voices of migrant sex workers' stories and their lived experiences to shape and form policy. It's also to improve the working environment of migrant sex workers and recognise sex work as a form of work. Supporting labour rights is integral to protecting against exploitation, including risk of trafficking. Actively promote the decriminalisation of sex work as the best model, as the best practice model. Next. Sex workers say,
nothing about us without us. Don't talking about us, talk to us. Only right can stop the wrongs. Don't talking to me about sewing machine. Talk to me about the workers' right. Saving us from salvation.
Save us from saviours.
Saviors, sorry.
Next. Thank you.
Thank you.
And now we're just going to be ready for questions and our answer session. So,
How long? 10 minutes?
and this part will be around, how long shall we say, Professor Nick Mai, for Q&A?
We can have 10 minutes, but I mean, we are not in a hurry. If there are more questions, we can keep on going, but I think about 10 minutes. We're a bit late, but I think this is it's a very important part. Hopefully there will be questions. So if you just write down your questions, then and say who you would like to answer, then we can get back to you. Not many questions.
And now is the time for the Q&A. If anyone has any questions, you're most welcome to put them up on the chat board, or you can ask them directed to any one of us. Thank you.
No questions? Okay.
Oh yes, we do have a question. Christchurch has a question.
Okay. Okay. Shall we just allow everybody? This is a bit. I will just allow everybody to talk, so that
there's a good question there from
from Lindsay.
Yeah.
So our first question asked by Dr. Lindsay Armstrong. Wow, that was amazing. 216 interviews is incredible. Congratulations. The recommendations are so important. What are the barriers to these changes being realised, and what strategies can be used to overcome them?
Willingness of government to make changes to the laws and to listen to those who are most affected by the laws, and to realise that these things do need to be changed. Going through Parliament would be the significant issue in that respect, I think. And to overcome them.
I was just going to say, like, there.
Sorry, Bridie.
Can you hear me now?
Yeah.
So, I mean, there's clearly a lot of barriers to legislative change. I suppose the reason I ask about policy change, it's around like the raids and stuff. I'm thinking about, you know, the Pickering case where we dealt with the worker who went to the police at our suggestion and with our support, and then shortly after, immigration raided, did a raid in the Blenheim, Marlborough, Nelson region, and our worker was ostracised from her community because the feeling was that by coming to NZPC and by coming to the police, she'd essentially narked to immigration. So what was really heartbreaking for us is we not only had, you know, a lack of support from police and immigration, her own community ostracised her because they felt they couldn't trust her. So what was distressing for us about that was that immigration chose to do that raid at that time. Whether or not that was as a consequence of our information, we don't know. But if they just, anyway, I'm digressing. Have they expressed a willingness to stop raids? Stop the raids, really? And the answer might just be a simple no, but I was just curious if, you know, the findings had been discussed with them, if they'd sort of said, oh shit, that's really bad, you know, we can't keep having this, and it's going to take too long for the law to change. And and I think that the policy changes is how, like, before we actually passed the Prostitution Reform Act, we had a commitment from police to stop prosecutions. It didn't happen. We know people were prosecuted right up until the evening the law passed, but there were at least some police who expressed a willingness to stop, you know, enforcing bad law. We see it now with the cannabis law. You know, even though cannabis is still illegal, it's widely acknowledged that prosecution for possession is a waste of police resources, so they tend not to do it. Is there a willingness here for immigration to accept that it's law?
No. Could I make a comment?
Sure.
Oh, hi, look, it's Catherine Healy. I don't think there is a willingness. Recently, the former Minister of Immigration, Ian Lees-Galloway, made a comment about Section 19 to the effect, he said, it's obviously working because we don't have any trafficking reports inside the sex industry. The second thing I want to say is that often in the anti-trafficking prohibitionist space, you hear solutions put up about more monitoring of brothels, more engagement by authorities with brothels. And I will answer my own concern here. I have real concerns about that as a suggestion, because I well recall working, you know, as a sex worker in a criminalised environment when we were all put on a police register. And when that suggestion is put forth, I see some state authority going in and recording the names yet again of sex workers, and it, as we know, contributes to inhibit people in their lives. We haven't got a level playing field, and stigmatisation, you know, if your name's on a database, all of those things concern me.
Yeah, the registration schemes that they are proposing, the extra monitoring that they're proposing, all add barriers to sex workers if they want to leave the sex industry. There are still people who have questions and queries about being on the previous register that was kept by the police here prior to decriminalisation, and that's 17 years ago now. But
I'm also interested, and I know, I think maybe the Human Rights Commission are here, I'm not sure, but they picked up the CEDAW recommendation, and I'm interested because they've included it in their recommendations that the Section 19 could possibly be amended. I'm wondering if anyone from the Human Rights Commission is here to comment.
Oh, they could be muted.
What, and then we can't hear them?
No, you can mute.
Yeah, if they're going to make it.
Well, they could mute. There could be a technical barrier.
Yeah, I have unmuted everybody, so you just have to unmute yourself and talk if you want to.
I think in terms of the recommendations, it would be critical to engage with the Human Rights Commission as perhaps one of the lead agencies.
yeah.
We also have, sorry, we just got 4 more questions are building up.
Yeah, I wanted to respond just tangentially to Catherine's question by saying that one of the findings across the board of the project is that you know, there should be less monitoring of that kind, but that definitely there should be a separation between immigration law enforcement and the so-called welfare visits. In the UK, they're called welfare visits, so the police is supposed to just check that everything is okay, but more often than not, there is the border force involved, and these visits become a immigration enforcement mechanism, which of course alienates migrants from availing themselves of services they might actually need. So I think that, you know, in addition to what was said about you know, there not being need for more monitoring, but definitely the one thing we're going to be try and push, because it comes very strongly from our data, is that, you know, in all circumstances, immigration control should be completely separate from any of these, you know, monitorings. I take the opportunity to respond to Talia and Kerida about Australia. The one thing that that makes the New South Wales legislation and the Australian legislation best practice is that people on temporary visa can work in the sex industry. And so that means that, you know, if something happens, then because they're not breaking the law, they can actually avail themselves of the protection of the law. So that alone is a huge difference and a very positive difference.
There was a question there from Kerry in regards to how much do you think the exploitation of workers in the hospital drives people to sex work for better treatment. Certainly some of the people that I interviewed were, they felt that because of the treatment they had received in hospitality, it was easier and better for them to work in sex work. That wouldn't be right across the board for everybody who's been exploited in the hospitality industry. But for some of those that I interviewed, it was certainly a driving factor.
And if I can add to that, I mean, this is something that was confirmed also by my previous studies that I did in the UK. The rhetoric was that sex work was always the last option. This was like the way it was advertised by abolitionists, but also the common discourse. But actually, the migrants I interviewed said that they felt, you know, that they were exploited in either sectors and that they would escape exploitation by working in the sex industry, because they overall found that they could find better working condition and escape the neoliberal, if you want, you know, fragmentation of labor rights. Some people actually put it like that.
Yeah. Okay. Just a comment from Gillian there, saying that she enjoyed the presentation and well done for completing such a fantastic study. That's good to see. Thank you, Gillian.
Yes, we echo that in Christchurch. It's really useful to have, you know, as much information. This, you know, information is really hard to get, unfortunately. So, you know, anything we can get is, yeah, really useful.
Thank you. Thank you.
Yeah.
We are going to, you know, we have recorded this session, so this is going to be available on the website, but we are going to be publishing, you know, policy briefs and more academic publications in order to try and give justice, you know, to all the knowledge that we were able to gather and all of the voices of people and that we've been able to listen to and that contributed to the study. So we're gonna try and disseminate as much as possible.
Okay, good.
Okay.
We don't have any more questions. We'd just like to thank everyone for attending the presentation today.
Thank you very much.
Thank you.
Thank you. Thank you,
very much.
everybody.
Thank you.
Thank you very much. Bye-bye. Thank you.
Bye-bye.
Thank you.
Bye-bye.
Well done, all of you.
Thank you, Joy.
Bye-bye.
Bye.
I mean, for those who are still with us, you're most welcome to ask us questions.
Yep. Otherwise, we can wrap it and then.
Yeah.
Yeah. Okay.
Okay.
Right.
Thank you.
Okay. Thank you very much.
Thank
Right. Goodbye.
both of you for this,
Bye.
and we can keep chatting on the other channel. Bye bye,
Okay.
everybody.